Hold on, let me put my cushion down.
I know that's right. Not her listening. Period, girl. That cushion gonna be your best friend, sister. All right, perfect. So right now we're doing part 2 of Miss Kamiyah's hot medic summer procedure. So part 2 right now she is getting liposuction. So basically, I already got her all set in the system and stuff like that. I'm just gonna go over what liposuction is. Basically, what we're going to do, like I said before, we're just gonna take the fat and we're just gonna shape you out. That's basically it. Make sure your waist and everything aligns. Give it nice and cute, nice and little tight, you know. Give it a little something, a little zhoosh and everything. Sucking some fat out, shaping it kind of like how I did with your BBL, but just the opposite. We're not going to put fat back in. We're taking the fat and we're just shaping it out. That's all we're going to do. Now, do you have any comments, questions, concerns about that?
No.
All right, now we're going to head right on back into the surgery room and we're going to go ahead and do what we did last time. You're going to go ahead and get bucket naked.
Wait, I do have a question.
Yes, ma'am.
Is this the invasive one or is it non-invasive?
Oh, that's a good question. Let me chat GPT that right quick. Hold on, let me do some research. That was a really good question. I did not think of that. Hold on, let me chat GPT.
Of course, by that she means she's thought of everything and she's just merely making sure that the answer is the correct answer for you as a patient.
I appreciate it, thank you.
Do you want me to collect a new set of vitals, Miss Dr. Zarcy?
Yes, please make sure that she is stable because you know she just recently had surgery, so I'm more concerned about her blood pressure being high. Who's that texting me? Oh, girl, I'll get you.
Wait, does this mean I have to take my cushion with me too for this surgery?
Oh, girl.
No, you'll be
That's
on.
cool.
You'll be
Oh,
on your
damn. That's not even.
side.
That's
Okay.
not even a thing for real.
You know, this cushion
Now
has
someone's
become
gonna call
second nature at
tonight.
this point, guys. It's like
Tonight.
it's glued to me at one point.
Yeah, that's a good thing. Okay, Dr. Zarcy, all vitals are within normal, healthy range.
Okay, thank you.
Would you like me to get the patient into her gown and on the operating table while you finish your research?
Yeah, so to answer her question, at the moment, we do not have non invasive. So ours is literally the old style way where we actually do make an incision in you and we literally use the machine to suck the fat out and shape your body. So at this moment, we do not have non invasive, but we could in the future. So thank you.
Thank you.
And what the holes are not going to be big though, so you ain't got to worry about it.
Oh, thank goodness. I want to be able to wear my belly button ring in
Yeah,
peace.
I'm not gonna hack you into pieces like Jason or Freddy, anything like that. No, the incision is gonna be big enough for me to fit my little suction in. That's it. It's not gonna be no big holes.
Because I'm trying to have a hot girl summer. I just don't want to walk around, with a scar or so.
Oh, we have scar removal as well. So if there's any scars that pop up, I could definitely remove those for you. But literally, there is little to no scars when I'm with procedures stuff like that because I do it excellent. I'm very, very careful about procedures and about patients' bodies because I'm a cosmetic surgeon. Like, I care about your body, so I don't want to cause any scarring or any tearing or anything like that. So I literally just try to do what's needed and not do the most.
And that's why I come to the best of the best.
Period. You already know what's up. All right. So go ahead into your gown. I'm gonna give you some time. If you need Jimmy to help you, you absolutely can, because you know you just got BBL and stuff like that. So, sir, you cannot be in here. I'm doing an RP. You're interrupted right now. All right, you're nice in your gown. So like I said, I'm just gonna get my handy dandy Sharpie, and I'm just gonna mark places in the area where I can do the lipo on. So give me a minute.
While she does that, I'm just going to prep an IV to be able to give you your anesthesia.
All right, so you do have some love handles. Okay, so you do have some love handles, which I could definitely work with. We're just going to go ahead and shake those out a little bit. Got a little bit of a pouch in the front. Don't worry about that. We're going to make that nice and flat. So I'll go ahead and make my markings on you. Basically, what Jamie's going to do once he's finished, we'll go ahead and knock you out, and then we'll go and continue on with the liposuction, okay?
Okay.
All right.
Okay, you know the drift. Whenever I insert the anesthesia, just come back from 10, okay?
Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, she's out.
All right, excellent. All right, going to make first incision now. All right, working on her left side right now. Sucking out the fat, shaping it up. Can I get a vital check, please? Thank you. Okay, I'm about to work on her middle section to see where she got a little bit of most of her. I'm gonna try to make sure we get that nice and flat for her. Left side is looking good. Middle's doing good. And now we'll go ahead and work on her right side. See, we're getting that waist nice and good. Suctioning fat, shaping her body out. Almost finished with the procedure. All right, she's all good to go. Right now, I'm just stitching her up. Make sure these lines are good. All right, you go ahead, get her nice and clean and dressed up. And boom, we are now finished with her lipo. All right, we're going to see if we can bring her back to life again.
Yes, ma'am. Yes, Quinn.
Hello, Kamiyah.
Hello.
Welcome back to the land of the living.
How did I do?
You did really good. So, the procedure went very well. Right now, as always, you're going to see some swelling, but it should go down within the next few hours, okay?
Okay, sorry, I'm a bit groggy, guys. Give me a minute.
Oh, sure. So, whenever you have the chance, go ahead. Wake up a little bit. Jimmy, see if you give her a cup of water. Then I'm gonna have you get back dressed up. Jimmy's gonna help you get back into your clothes. This time I want you to go ahead and put your faja on, because now you got your liposuction, your BBL. You're gonna need that faja real bad this time. So you're gonna go ahead and get your faja on. He's gonna help you out with that, and then he's gonna help you go ahead back on the couch, and I'm just gonna explain aftercare instructions to you and discharge. And please make sure you sip slowly. I do not want you choking because you have fresh stitches on you. And if you pop one of them stitches, then it's going to be a whole different procedure for you. Let me know
Ooh,
when y'all
thank
ready.
goodness you were there to help me, Jimmy. Almost fell. Child.
Oh, please do not fall. Listen, don't make my job harder than what it needs to be right now.
Yes, ma'am.
The body's getting snatched. You just gotta wait for that swelling to go down.
Okay, Kamiyah, come with me. Of course, you're fixing your hair.
Oh, I mean,
Cause that mask don't mess her doggone hair up sometimes, you know.
I'm saying I got pillow head. I gotta fix that baby.
All right, there you go. There's your nice handy dandy cushion. Go ahead and slowly sit down for me. It's not gonna take long for your instructions and discharge. We going all around the world. We going
Thank you,
all
Jimmy. You're
around the
so
world.
assisting.
You're welcome. I will go and get everything prepped for her discharge.
All right, thank you.
Dr. Z, you have outdone yourself again.
Oh, thank you. Stop it. You're making my head even bigger than what it is. No, for real, keep going. I'm playing.
Well, I mean, I'm happy I came to you. I mean, who else in the city was gonna do it?
I know, right? It's only me in the city. And with Jimmy underneath me, it could be me and Jimmy. You feel me?
Well, it's a great team so far. I'm just really happy with like my prior procedure, and as I heal with this one, I'm really looking excited to see what my body's out. And I'm outside.
Period, girl. You're going to be inside for a bit. If you go outside, it's going to hurt. But you'll be outside soon. So right now, I'm just going to go over a little bit of aftercare with you. As you know, you have to wear your faja. That's going to shape out your bottom area and also your waist area. It's basically the same things as your BBL. You're going to expect some swelling. It'll go down in a few hours, some bruising, some soreness, and some draining. Don't worry about it. It will go away. But if it continues, please come back here. Make sure you walk frequently. As I said, just like the BBL, to promote circulation and no blood clots. Avoid heavy lifting. You on light duty. Look, like I like to tell my people, right now you're a baddie. You can't really touch any. You can't really do too much. You gotta do very, very little. Make sure you do some walking exercises at least for at least 4 to 6 weeks. Do some walking. Try to walk at least 4 to 5 times, like a little bit in the morning, a little bit in the afternoon, a little bit if it's safe in your area, a little bit at night. Make sure you keep your incision sites clean. Try to avoid getting any soap in them. If you have any soap and these are fresh incision sites, it could get infected. So please be mindful of that. Keep them clean and keep them dry. What I like to tell people, get a little alcohol pad and just dab the area. Just dab the area like that. Change dressings as instructed. So you will be changing your dressings at least 3 to 4 times a day. Because like you gotta keep the area nice and clean, and the way to get the site clean is to make sure you're changing your dressings frequently. Stay hydrated, please. Also, eat high protein. Don't eat too much because you got fresh stitching. So no Chipotle, no Popeyes, no Arby's, no none of that.
So like a
Okay.
soft food diet?
Basically a soft food diet, girl. You're gonna be drinking smoothies. Everything is gonna be blended up in a smoothie for you. Because I can't have you eating no oily, fatty foods at this moment because it's not going to be good for you. But if you do need to make up a diet plan, I can refer you over to the nutritionist department and somebody can speak with you about a diet plan for your liposuction. I did that to another patient, so I'm all up for it if you want to do it. Also, make sure you take the medications prescribed. I'm going to prescribe you the same medications, but you just got to set medications. I'm going to put a second set in, but you have to make sure you take the first set. Once that first set of medication is totally done, then you go ahead and pick up your second set, all right? And make sure you're taking them as prescribed. You take your Tylenol every 8 hours, and you take your antibiotic once a day, okay? Also, you're going to avoid smoking, vaping, any alcohol, any nicotine products whatsoever. So if you smoke, drink, you're going to be sober for a very, very long time. All right. So please refrain from smoking and drinking. Like I said, do not soak in any bathtubs, hot tubs. Don't be in no swimming pools. You're going to be a baddie for a couple of weeks. So you're going to be a baddie on the side. Always come back if you have a fever, if there's any redness, swelling, any warmth, any pus-like drainage from the incision sites, any severe or worsening pain, not relieved by medication, excessive bleeding, chest pain, shortness of breath, or calf swelling pain, persistent nausea or vomiting or dizziness. Please come back and see us if any of those things happen, and we will gladly help you. Now, do you have any comments, questions, concerns, emotional outbursts at this moment?
I mean, I'm not sure if I should ask this, but what are my limitations on physical activity?
Physical activity wise, you're going to be very limited. You can't do
Please do
nothing
not
heavy.
interrupt. Go ahead and leave.
Okay, so for your limitations, basically, you're going to just, if anything, try not to do anything. Movement is going to be very, very limited with you, especially with the procedures that you're going to have. You can't really sit too long. You got to walk a lot. You can't really pick up any heavy things. So please be mindful of that. The most that you could do right now is just pick up a remote and do light exercise. But at this point in time, you can't really do anything too heavy. That
Child, that's
too.
what I was referring to. Oh, Father.
Yeah, girl, you're gonna be lonely for a little bit. So yeah, because they're gonna be on your body and stuff
Child.
like that, and that's gonna hurt very much so, very badly, unless you can figure something out. But I rather for you not do that. The cushion, that faja, you walking around is gonna be your best friend for a very, very long time. Do you have any other
Approximately
question?
how long? Yeah, how long is the healing process?
The healing process is 4 to 6 weeks for both procedures. So about 2 months for each. I am going to do a 1 month follow up for all the procedures being done because they, at that point in time, they should start to heal and they should start to do a little bit better. So I will mark you up for 1 month time of follow up as soon as I get finished with your other procedure.
Okay.
All right. So I'm just going to update your information. All right, getting that all in the system. And you are all set. Just update your chart. All right, so you're all good to go. Pretty sure Jimmy handed over your discharge paperwork and everything like that. Just like I said, please follow your aftercare instructions. Those are very, very important. And if you would like, I could send a referral over to the nutritionist department so that you can have a set diet plan.
Yes, please.
Would you like a referral?
Yes, please.
All right, good. So I'm gonna set up referral to the nutritionist department. Right now, you're all set to go.
Thank you.
You're welcome.